A heavy rhythmic grind of rusted iron against a damp whetstone echoes in the absolute dark. A single sliver of moonlight slices through the suffocating gloom, catching the jagged teeth of a bone saw. The air is impossibly thick, choking your lungs with the coppery stench of old blood and the sharp burn of carbolic acid. You cannot move, bound entirely to a freezing slab of marble by raw leather straps biting deep into your bare skin. Above you looms a faceless silhouette, a towering shadow engulfed in high-contrast monochrome. His heavy leather apron is stiff, gleaming with the blackened, dried remains of the unfortunates who came before you. But this man is not a deranged executioner, and this room is not a hidden torture chamber beneath a tyrant's castle. This is a prestigious hospital operating theater in the beating heart of the 19th century, and the man raising that unwashed blade above your chest is the most respected medical mind of his generation. Before the quiet mercies of anesthesia and sterilization, the surgeon's table was an altar of absolute waking agony. Pain was not a tragic symptom to be managed or minimized by a compassionate healer. It was a violent crucible, a physical shock deemed absolutely necessary to aggressively purge the body of internal corruption. The tools of this dark era were not crafted for delicate precision or the gentle preservation of human tissue. They were mechanical nightmares forged from heavy iron, cold brass, and a deadly overarching ignorance. To look upon these devices today, resting in their velvet-lined boxes, is to gaze into an abyss of unimaginable suffering. Every twisted gear, spring-loaded blade, and serrated edge tells a terrifying, forgotten story. They speak of fragile lives brutally torn apart in the name of scientific progress. We revere modern medicine as a pristine world characterized by sterile light and painless miracles. But underneath the spotless white tiles of our clinics lies a subterranean foundation built entirely on shattered bones and silent screams. This forces us to confront a deeply unsettling truth about the nature of our own survival. How much flesh had to be brutally mangled in the dark before humanity finally learned how to heal? When exactly does the desperate, noble pursuit of a medical cure cross the invisible boundary into orchestrated mechanical torture? Tonight, we step back into the fog-choked shadows of the Victorian medical underground to examine these physical relics. Prepare to face the 10 most barbaric and bizarre surgical instruments ever conceived by the ambitious minds of men. Welcome to the golden age of agony, where your trusted doctor was undeniably the most dangerous monster in the room. The blood on the marble table has barely dried, yet the human mind instinctively recoils, desperate to understand how such profound, unmitigated brutality was ever officially sanctioned. To truly comprehend this era of authorized butchery, we must step out of the operating theater and into the suffocating, heavy smog of the 19th century. Picture the sprawling industrial streets of London or Paris, rendered in stark monochrome, where the air itself was a thick, poisonous soup of coal ash and human decay. Faceless silhouettes hurried through narrow, dimly lit alleyways, clutching filthy rags to their faces, terrified of an invisible enemy they referred to as the miasma. In this shadowy, Gothic reality, life was agonizingly fragile, and death was not a distant possibility, but a constant, hovering companion sitting quietly by the hearth. We look back today with the comfortable luxury of modern science and quickly judge these historical physicians as arrogant monsters, wielding their rusted tools with reckless abandon. But beneath those stiff, blood-stained leather aprons beat the hearts of deeply desperate men, waging a relentless and ultimately losing war in complete and utter darkness. The true underlying tragedy of Victorian medicine was not a fundamental lack of compassion, but an absolute, crippling ignorance of the microscopic world. Before the life-saving revelations of germ theory, humanity remained totally blind to the silent, invisible armies of bacteria that were slaughtering them by the thousands. Without this vital knowledge, society clung fiercely to ancient, deeply flawed philosophies regarding the delicate balance of bodily humors and the physical manifestation of spiritual corruption. They fundamentally believed that severe illness was a profound, rotting imbalance taking root deep within the flesh, requiring an equally violent and dramatic extraction. The prevailing medical logic was terrifyingly simple. If a disease was slowly devouring a patient from the inside, a gentle approach felt hopelessly inadequate against such a beast. The public mind implicitly demanded an aggressive, highly visible counterattack, deeply mistaking the sheer physical trauma of the treatment for the genuine mechanism of a cure. Consider the raw, untamed humanity of the situation. When you watch someone you love gasping for their final rattled breaths, you do not beg the doctor for caution. You beg for absolute salvation at any cost, willingly surrendering them to the undeniable horrors of the surgical saw if it promises even a faint whisper of survival. This profound collective desperation created a terrifying psychological loop across the entire continent, deeply embedding the acceptance of extreme suffering into the broader culture. Extreme pain was widely and unquestioningly accepted as the necessary agonizing toll demanded by the harsh tollkeeper of life in order to grant a second chance. Medical practitioners naturally evolved into the high priests of this bloody, desperate religion, their unquestioned authority growing with every screaming patient strapped to their wooden tables. The high contrast, unforgiving reality of their daily existence left absolutely no room for hesitation, cowardice, or delicate moral deliberation. Either the surgeon carved the festering corruption out of the body with brutal, blinding speed, or the grieving family buried the patient in the cold earth by Sunday. The deep, heavy shadows of the era masked a society that was collectively traumatized, grasping blindly at anything that resembled a systematic defense against the Grim Reaper. It is incredibly easy to label this entire historical period as an age of sheer, unadulterated madness, a time when humanity completely abandoned its empathy for cruelty. But the haunting, undeniable truth is that this widespread collective ignorance was born entirely from a deeply human, overwhelming fear of the encroaching dark. They voluntarily subjected themselves to these tortuous, nightmare-inducing instruments, because the only thing more terrifying than the cold iron blade was the absolute finality of the grave. And so, the gruesome theater of trauma continued unabated in the dim, flickering gaslight, rationalized by terror and justified by a desperate yearning to simply keep breathing. This tragic, unflinching mindset paved a dark, blood-soaked path for the specific, nightmarish tools that would soon come to physically define this golden age of agony. The desperate need for a highly visible, dramatic cure found its most terrifying expression in a practice as old as human civilization itself. But in the gaslit, grime-covered medical theaters of the 19th century, this ancient ritual was perfected into a brutal, mechanical art form. Imagine a solitary room, cloaked entirely in heavy, high-contrast shadows, where the air sits stale, cold, and completely motionless. Pinned against a heavy wooden chair is the faceless silhouette of a man, his features completely swallowed by the oppressive surrounding darkness. He is merely a laborer, a father whose only crime was suffering from crushing, persistent migraines that modern science could easily cure with a simple pill. But in this specific era of ignorance, his internal agony is confidently diagnosed as a dangerous accumulation of pressure, a dark vapor trapped tightly beneath his skull. The proposed salvation is a deeply invasive procedure known as trepanation, a mechanical, violent descent into the very core of human consciousness. From the inky shadows emerges the physician, another faceless shadow, his stiff leather apron glistening with the rust-colored stains of a dozen previous miracles. He approaches the trembling patient not with calculated malice, but with the terrifying, absolute certainty of a righteous, untouchable savior. In his hands, he cradles the instrument of grace, a heavy brass-handled skull trephine, gleaming coldly under the light of a single flickering candle. It heavily resembles an industrial hand drill, equipped with a sharp central pilot spike, surrounded by a brutal serrated crown of iron teeth. There is no gentle chemical lull into unconsciousness, no merciful numbing of the scalp before the waking nightmare officially begins. The surgeon's towering assistant firmly grips the patient's head, locking it in place against the unyielding, blood-stained wood of the heavy chair. The suffocating silence of the room is suddenly shattered by the sharp, sickening sound of the central iron spike piercing the soft flesh of the scalp. A thick, dark stream of hot blood immediately escapes the wound, running fast and completely unchecked down the side of the man's unseen face. But the true, unfathomable horror has not yet begun, where the surgeon must now securely anchor the jagged teeth of the saw directly against the bare skull. He begins to twist the heavy wooden handle, pressing down with the full aggressive weight of his shoulders to force the iron deep into the bone. The grinding noise is intimately deafening, a hollow, resonant scrape that echoes violently and relentlessly inside the terrified patient's own head. You can clearly hear the wet, rhythmic crunch as the serrated crown bites deeper, aggressively tearing through the tough outer layer of the cranium. With every single agonizing rotation, the patient's knuckles turn completely bone-white against the leather restraints, his body fighting a primal, screaming urge to flee. He cannot scream aloud, for the sheer, overwhelming magnitude of the pain has entirely paralyzed his vocal cords, leaving only short, ragged, breathless gasps. The surgeon pauses momentarily to casually wipe away the thick mixture of dark blood and white bone dust that rapidly clogs the teeth of his instrument. He works with a frantic, sweating intensity, completely and tragically blind to the agonizing psychological torture he is inflicting upon the shadow in the chair. In the doctor's mind, he is performing a profoundly heroic act of liberation, physically drilling a literal escape hatch for the invisible demons of disease. He resumes the relentless turning, the cold metal scraping closer and closer to the delicate pulsating membrane that protects the fragile human brain. The atmosphere in the room grows suffocating, heavy with the sharp metallic tang of fresh blood and the terrifying musky scent of raw human terror. The stark contrast between the physician's deeply noble intentions and the sheer barbaric physical reality of his actions is absolutely devastating to witness. Finally, after an eternity of waking nightmare, a sharp, distinct crack loudly signals that the iron teeth have breached the final innermost layer of bone. The surgeon carefully uses a rusted elevator tool to pry the perfect bloody circular disc of skull loose from the terrified man's trembling head. A sudden rush of dark blood follows the bone, a release of physical pressure that the doctor triumphantly and tragically misinterprets as a total medical victory. He stares down into the dark, gaping hole, quietly observing the exposed, rhythmic beating of the human brain under the flickering, uneven candlelight. The patient, slumped heavily forward in the thick leather straps, hovers dangerously on the fragile, razor-thin edge of profound shock and complete cardiovascular collapse. But the tragic, underlying irony of this brutal descent into the mind is that the immediate, agonizing physical trauma was rarely the final executioner. The doctor, glowing with the immense, arrogant pride of a highly successful operation, does not wash his hands before gently binding the open wound. He uses soiled cotton bandages that have rested on unwashed wooden tables, inadvertently packing the deeply vulnerable brain with invisible, highly lethal contaminants. The man miraculously survived the gruesome, high-contrast theater of the drill, only to be quietly handed over to the silent, suffocating grip of severe bacterial infection. Within days, the very procedure explicitly designed to relieve his crushing pain will ignite a raging fever, swelling his delicate brain until it completely extinguishes his life. He will die entirely alone in a dark, overcrowded ward, just another anonymous, forgotten casualty in the blind, arrogant, relentless march of medical progress. His shattered, unhealed skull will eventually be tossed unceremoniously into a mass grave, a permanent, silent testament to the catastrophic, deadly cost of good intentions. We can only attempt to imagine the profound, isolating terror of being that patient, locked inside a decaying body, hopelessly betrayed by the very people promising salvation. The faceless silhouette of the surgeon calmly wiping his bloody tools on his dark apron becomes a haunting, eternal symbol of profound, institutionalized hubris. They fundamentally misunderstood the sacred, intricate architecture of the human body, treating the delicate skull not as a fragile sanctuary, but as a stubborn vault to be violently cracked. In their desperate, misguided crusade to drag humanity out of the suffocating darkness of disease, they repeatedly plunged their trusting patients straight into the abyss. The sacred incision they so deeply revered was never actually a doorway to genuine healing or relief. It was merely a formally engraved, blood-soaked invitation for the Grim Reaper to step confidently inside the room. As the brutal, echoing crunches of the surgeon's bone saw faded into the suffocating smog, a new, far more insidious nightmare began to quietly take root. The high-contrast, bloody theater of physical trauma slowly gave way to the claustrophobic, shadow-drenched confines of the Victorian apothecary, a subterranean laboratory of silent horrors. Imagine a damp, windowless room where the heavy air is permanently laced with the sharp, acidic bite of sulfur and the sickeningly sweet scent of chemical decay. Flickering candlelight casts towering, distorted silhouettes against walls lined entirely with rows upon rows of thick, opaque glass jars, their contents hidden in the gloom. Inside these heavily sealed vessels lie not the organic, gentle remedies of a compassionate healer, but the heavy, refined elements of profound earthly devastation. Here, the immediate agonizing violence of the surgeon's rusted blade was elegantly replaced by the agonizingly slow, creeping death of the physician's carefully measured vial. The terrifying reality of this era was that society had developed a deep, fatal obsession with chemical purity, tragically mistaking heavy toxicity for supreme medicinal power. Step closer to the heavy wooden counter, where the faceless silhouette of a distinguished doctor gently swirls a mesmerizing heavy silver liquid inside a delicate glass beaker. This is quicksilver, known to us today as mercury, a substance so inherently unnatural and dense, it seems to defy the very laws of the physical world. To the desperate, terrified minds of the 19th century, its heavy liquid grace was viewed as a divine cleansing force, perfectly capable of scouring disease entirely from the blood. It was heavily prescribed for a terrifying array of human ailments, most notably the rampant flesh-eating plague of syphilis that was quietly ravaging the city's hidden underworld. The prescribed cure, however, unleashed a form of visceral body horror so profound it would easily rival the darkest, most twisted nightmares of any Gothic fiction. Patients were aggressively instructed to swallow heavy doses of the silver poison, or to lock themselves completely inside suffocating heated chambers filled entirely with toxic mercury vapor. The trusted doctor proudly promised absolute salvation, completely blind to the tragic fact that he was systematically dismantling the patient's central nervous system from the inside out. The deeply tragic human cost of this chemical crusade was not measured in sudden violent screams, but in a slow, agonizing disintegration of the human self. Imagine the sheer, isolating terror of waking up in a cold sweat, only to taste the overwhelming metallic tang of raw poison heavily seeping through your own gums. The mercury worked with a ruthless, silent efficiency, first violently attacking the mouth, causing the gums to rot completely and perfectly healthy teeth to loosen and fall. Patients would produce liters of thick, uncontrollable saliva, their jaws swelling into grotesque, painful deformities as the heavy metal aggressively settled deep into their fragile bones. But the most devastating toll was completely invisible, a creeping, relentless rot that slowly climbed up the spine and burrowed incredibly deep into the fragile human mind. Severe neurological tremors, historically known as the terrifying Hatter's shakes, would violently seize their limbs, permanently robbing them of the simple dignity of feeding or dressing themselves. The final, horrific stage was a profound, inescapable descent into total psychological madness, characterized by severe paranoia, overwhelming anxiety, and terrifying waking hallucinations in the dark. The patient was effectively trapped entirely inside a rapidly decaying shell, their mind shattering into jagged pieces, while the trusted doctor calmly noted their excellent medical progress. There was a deeply disturbing, whispered medical proverb from this era that perfectly captured the utter futility of the treatment. A night with Venus and a lifetime with Mercury. Yet, mercury was not the only heavy element hiding comfortably in the shadows of the apothecary, masquerading brilliantly as a benevolent agent of health and vitality. On the adjacent wooden shelf, bathed in the dim, high-contrast light, sits a perfectly unassuming bottle filled with a clear, slightly sweet-tasting liquid known as Fowler's solution. The active ingredient in this incredibly popular, highly sought-after medical tonic was a concentrated, lethal dose of pure, unadulterated potassium arsenite. Arsenic, a substance we now universally recognize as a premier, absolute instrument of murder, was aggressively marketed as a daily revitalizing health tonic for the delicate Victorian constitution. It was specifically prescribed to young, desperate women who were deeply desperate to achieve the pale, ghostly, tubercular aesthetic so heavily romanticized by the era's morbid culture. They willingly swallowed measured drops of liquid death every single morning, deeply believing it would purify their blood and grant them a haunting, fragile, aristocratic beauty. And it did temporarily, by systematically destroying their red blood cells, entirely replacing a healthy human flesh with the chilling, breathless pallor of a walking corpse. The slow poisoning of these young women is a tragedy woven perfectly into the suffocating fabric of a society that prioritized a deadly aesthetic over genuine human vitality. Their internal organs were slowly, quietly failing, their skin heavily breaking out in painful, darkened lesions, while the high society around them praised their striking, ethereal appearance. The atmosphere of this historical era feels intensely claustrophobic, a massive, inescapable labyrinth where every single hallway simply leads to a completely different flavor of poison. We watch these faceless silhouettes unknowingly drinking their own demise, and our modern hearts break completely against the impenetrable, unyielding wall of recorded medical history. They were completely innocent victims, caught helplessly in a terrifying transitional phase where the dangerous ambitions of chemistry vastly outpaced the essential, protective safety of biology. The physicians, blinded entirely by the arrogant, blinding glow of their own intellectual vanity, sincerely believed they were finally mastering the deep elemental forces of nature. They documented the severe vomiting, the bloody diarrhea, and the agonizing muscle cramps not as warning signs of a fatal overdose, but as triumphant proof the medicine was working. This deeply flawed, backwards logic transformed the human body into a brutal, unforgiving battlefield, where the collateral damage was always, invariably, the patient's own fragile life. The rusted surgical saws and heavy skull drills were undeniably terrifying, but they offered a swift, highly visible conclusion to the agonizing, bloody theater of trauma. These dark chemical cures, however, stretched the immense suffering out over agonizing months and years, transforming the patient's own quiet home into a solitary, inescapable torture chamber. Imagine the profound, suffocating despair of faithfully taking your prescribed medicine every single day, only to feel the cold, heavy shadow of death creeping inches closer each night. You look into the opaque glass vial on your nightstand, completely unaware that the trusted hands meant to pull you from the darkness are the exact same hands holding you under the water. The true horror of the Victorian laboratory was the absolute, profound betrayal of ultimate trust, hidden perfectly beneath the elegant, sweeping, cursive handwriting on a toxic prescription label. As the gaslight flickers and the heavy, stark shadows stretch longer across the apothecary walls, the sheer, devastating scale of this invisible chemical slaughter begins to truly crystallize. But the escalation of medical hubris did not merely stop at poisoning the living. The deeply insatiable hunger for anatomical knowledge was about to drag these respected doctors straight into the graveyard. The relentless poisoning of the living was a quiet tragedy, but the insatiable hunger for anatomical mastery demanded a far darker currency. To truly understand the intricate, terrifying machinery of the human body, these ambitious physicians needed an endless supply of fresh canvas. But the strict, unyielding laws of the 19th century fiercely protected the dead, leaving these desperate surgeons starving for raw material. This severe medical famine birthed the most macabre, deeply unsettling partnership in the entire shadowy history of human science. The high-contrast silhouettes of distinguished doctors secretly shook hands with the absolute lowest, most dangerous dregs of the Victorian criminal underworld. They became the quiet, wealthy patrons of the Resurrection Men, ruthless gangs who stalked the fog-choked graveyards under the cover of midnight. Imagine the chilling, muffled sound of a wooden spade breaking the heavy, frost-hardened earth long after the grieving family had departed. The stolen dead were unceremoniously hauled away in rough burlap sacks, delivered through the hidden back alleys of prestigious medical academies. Here lies the profound, deeply uncomfortable turning point that forces us to radically reevaluate everything we know about these historical healers. In the flickering, suffocating gaslight of the dissection room, the boundary between a visionary genius and a cold-blooded psychopath completely dissolved. Were they noble pioneers, bravely sacrificing their own morality to map the hidden, complex geography of the human nervous system? Or were they simply deeply obsessed sociopaths, hiding their grotesque, violent compulsions behind the highly respected facade of a medical degree? What kind of mind looks at a freshly buried child and sees only a fascinating mechanical puzzle waiting to be aggressively dismantled? The psychological detachment required to casually slice through the cold flesh of a stolen neighbor defies our modern understanding of basic human decency. Yet, they meticulously documented every severed nerve and shattered bone in beautifully illustrated leather-bound journals that are still revered in medical libraries today. Their elegant cursive handwriting completely masks the brutal, violent desecration that took place under the flickering, unforgiving glow of the basement lantern. When you pay a hardened criminal to drag a stolen corpse onto your marble table, are you still practicing the noble art of healing? These prominent surgeons would spend their nights aggressively dismantling the stolen dead, their heavy leather aprons soaked in putrid, rotting fluids. And then, as the pale morning sun pierced the thick city smog, they would simply wipe their bloody blades on a dirty rag. Without ever washing their hands, they would confidently walk straight into the pristine operating theater to physically deliver a newborn child. This is the ultimate horrifying twist of the era, the fatal blind spot that transformed brilliant men into inadvertent serial killers. They fiercely debated the complex philosophy of disease, entirely unaware that the Grim Reaper was hiding directly beneath their own fingernails. The profound, terrifying implication is that the greatest threat to a Victorian patient was never the severe illness that originally brought them to the clinic. It was the highly decorated, impeccably dressed chief of surgery who sincerely believed his elevated social status made him completely immune to carrying disease. They wore their hardened, blood-stiffened surgical coats exactly like prestigious military medals, proudly displaying the accumulated filth as undeniable proof of their vast experience. The very hands that beautifully mapped the elegant arteries and charted the delicate chambers of the heart were aggressively planting the seeds of death. This devastating phenomenon reached its horrific peak in the maternity wards, where completely healthy young mothers were suddenly struck down by mysterious fevers. They called it puerperal fever, a terrifying, highly lethal infection that swept through the hospital beds like a silent, invisible wildfire. The tragic irony is almost too heavy to bear. The doctors were desperately trying to save lives while unknowingly acting as the chief executioners. When a lone, brilliant physician named Ignaz Semmelweis finally noticed this terrifying pattern and begged his colleagues to simply wash their hands, he was violently mocked, fiercely ostracized, and ultimately driven completely insane by the arrogant medical establishment that categorically refused to listen. How could the most educated, sophisticated minds of a generation be so incredibly blind to the blood literally dripping from their own fingers? The answer lies in the terrifying, impenetrable fortress of human ego, a pride so massive it completely eclipsed any basic sense of empathy. To admit that their unwashed hands were causing this mass slaughter would mean accepting responsibility for thousands of agonizing, unnecessary deaths. It was far easier to stubbornly blame the invisible miasma in the air than to look down at their own filthy, contaminated skin. This deeply psychological refusal to confront their own monstrous reflection reveals the darkest, most enduring truth about the nature of humanity. The most dangerous element in any medical theater is never the rusted saw, the heavy drill, or the toxic silver poison. It is the absolute, unquestioned certainty of the man holding the blade, completely convinced that his noble intentions justify any amount of collateral damage. The macabre paradox of this bloody era is that their unforgivable crimes against the dead ultimately provided the foundational blueprints for our survival. Every single textbook of modern anatomy, every flawless surgical procedure we rely upon today, was originally drafted in the shadowy, stolen blood of the forgotten. We owe our extended lifespans to these flawed, deeply corrupted men who eagerly danced with the devil to unlock the secrets of the flesh. But as we stare at the faded, monochrome portraits of these esteemed surgeons, their cold, unblinking eyes seem to follow us through the dark. They force us to silently wonder if the line between a miraculous healer and a brutal monster is simply a matter of historical perspective. Would we still revere them as visionary pioneers if we had to personally endure the agonizing, waking nightmares they so easily authorized? Or would we see them for what they truly were, desperate men wielding rusted iron in the dark, destroying lives to accidentally build the future? We have spent so much time examining the rusted iron and dissecting the arrogant minds of the men who wielded it. But the true, suffocating weight of this dark history does not rest with the famous surgeons or their beautifully illustrated textbooks. It rests entirely upon the heavy, silent marble slabs, bearing the invisible weight of the forgotten souls who never walked out. Strip away the prestigious medical titles, the grandiose scientific theories, and the sterile distance of historical hindsight. What remains is a chilling, high-contrast monochrome landscape populated entirely by the faceless silhouettes of the anonymous dead. They were not willing martyrs sacrificing their fragile bodies for the glorious upward march of modern human medical progress. They were terrified mothers, exhausted laborers, and frightened children, driven to the absolute edge of human desperation by relentless pain. Imagine the sheer, isolating terror of crossing the threshold into a Victorian charity hospital, knowing intimately it was a final destination. The air inside the crowded ward is impossibly thick, completely saturated with the sweet, sickening smell of gangrene and unwashed bodies. You lie in the stifling dark, surrounded by a chorus of ragged, desperate breathing, entirely separated from the outside world. The heavy wooden doors are locked tight, severing you entirely from the comforting warmth of your family and the life you knew. In the suffocating shadows of the night, every single approaching footstep echoing on the cobblestone floor sounds exactly like an executioner. You pull the thin, coarse wool blanket up to your chin, trembling violently as the grim silhouette of the ward nurse passes by. There is no gentle reassurance here, no soft words of comfort whispered in the dark to soothe your racing, terrified heart. You are no longer treated as a human being possessing a name, a family, a precious past, or a meaningful future. In the cold, mechanical eyes of the medical establishment, you've been abruptly reduced to a fascinating, highly disposable biological defect. You are simply the diseased liver in bed number 4, or the shattered femur waiting quietly on the rusted surgical trolley. When your terrifying moment finally arrives, strong, uncaring hands roughly strap you down onto the freezing, unyielding surface of the operating table. The coarse leather restraints bite aggressively into your bare wrists, a brutal physical reminder of your absolute, inescapable powerlessness in this room. Above you, the flickering gaslight casts towering, distorted shadows across the brick walls, transforming the attending medical students into silent, looming gargoyles. They crowd eagerly around your naked, trembling form, their eyes entirely devoid of empathy, eagerly waiting for the bloody spectacle to begin. The surgeon approaches, his face completely obscured by the deep shadows, his hands already stained with the dried blood of strangers. You stare helplessly into the abyss of his dark silhouette, desperately searching for a single glimmer of humanity, of mercy, of hesitation. But you find absolutely nothing but the cold, terrifying certainty of a man who firmly believes he possesses the ultimate power of God. The cold iron of the blade violently presses against your feverish skin, and the entire world abruptly shrinks down to a single point of agony. In that final, blinding moment of unimaginable trauma, the deep, suffocating emotional isolation is far more agonizing than the surgical cut itself. You realize, with a heavy, sinking despair, that you are dying entirely surrounded by people, yet completely and utterly alone. Your silent, ragged screams are quickly swallowed by the cavernous, echoing walls of the amphitheater, ignored by the men furiously taking note. As your vision slowly begins to fade into a permanent, merciful blackness, the very last sound you hear is the scratch of a pen. It is the sound of your excruciating death being casually reduced to a single, clinical sentence in a heavily bound medical journal. Your body, completely drained of life and dignity, will soon be quietly dragged down into the damp, freezing depths of the hospital basement. There will be no dignified funeral, no carved headstone marking your passage, no weeping family allowed to softly hold your hand. You will simply be dissolved in quicklime or sold quietly to the anatomy students, completely erased from the fabric of human existence. These faceless silhouettes are the true, unacknowledged architects of our modern medical miracles, the silent, bloody foundations of our sterile clinic. Every single drop of anesthetic, every perfectly sterilized scalpel we take for granted today was paid for entirely in their unspeakable suffering. We owe an impossible, unpayable debt to the countless, anonymous victims who were brutally dismantled in the dark, fog-choked belly of history. Their final, terrified breaths still echo quietly within the pristine, brightly lit hallways of our modern hospitals. If we only dare to listen, we walk confidently through the pristine, brilliantly illuminated corridors of modern hospitals, completely shielded from the gruesome realities of our medical past. We willingly surrender ourselves to the gentle, chemical sleep of modern anesthesia, trusting completely in the sterile grace of microscopic precision. But the spotless white tiles beneath our feet are securely laid upon a vast, hidden subterranean foundation of shattered bone and rusted iron. Every painless incision, every miraculous organ transplant, and every quiet, dignified recovery is a direct, life-saving dividend paid entirely from their absolute agony. The faceless silhouettes who screamed in the suffocating dark, bound tightly to freezing marble slabs, were the deeply unwilling pioneers of our salvation. We are not merely standing on the broad shoulders of brilliant, visionary scientists. We are standing heavily on the broken backs of the anonymous dead. The terrifying, invisible boundary between a desperate, noble cure and orchestrated, mechanical torture was never clearly drawn in ink or established by moral law. It was violently carved directly into living human flesh, defined inch by agonizing inch through centuries of blind, bloody trial and devastating error. The distinguished physicians of the Victorian era were not monsters born of pure malice, but profoundly terrified men wielding the heavy, dangerous weapons of ignorance. They boldly navigated the terrifying, uncharted darkness of the human body using only the flickering, deeply unreliable gaslight of their own massive ego. Yet, without their arrogant, brutal trespasses into the sacred, protected architecture of the flesh, the life-saving knowledge we possess today simply would not exist. The rusted, blood-stained amputation knife and the heavy iron skull drill were the crude, terrifying keys that eventually unlocked the delicate miracles of modern surgery, which heavily forces us to look away from the deep shadows of the 19th century and quietly question the pristine, confident reflection of our present moment. When the sophisticated surgeons of the 22nd century look back at our current, celebrated methods of aggressive chemotherapy and deeply invasive radiation, will they view our most advanced, desperately sought life-saving treatments with the exact same shudder of profound, unforgiving historical horror? Will they stare at the sterile, gleaming metal of our modern scalpels and wonder how humanity ever tolerated such barbaric, physical destruction of the fragile body? The golden age of agony may have officially faded into the thick, choking fog of history, but the fundamental, desperate human drive for survival remains entirely unchanged. We are still incredibly fragile, terrified creatures, blindly negotiating with death in the dark, forever hoping that the blade hovering above our chest is held by a healer. The agonizing, echoing screams of the Victorian past have finally fallen completely silent, peacefully replaced by the steady, reassuring electronic rhythm of the modern heart monitor. But the heavy, metallic scent of the rusted iron saw still lingers very softly in the sterile, conditioned air of every operating room. As the flickering candlelight finally extinguishes on this dark, forgotten cabinet of medical nightmares, we are left entirely alone with an unsettling, undeniable truth. Humanity did not gracefully discover the divine art of healing through gentle, enlightened compassion. We brutally extracted it from the gripping jaws of absolute torture. As we finally step out of the suffocating, gaslit shadows of the Victorian operating theater, the heavy iron doors firmly and permanently lock behind us. The rusted bone saws and the heavy brass traphenes are safely returned to their velvet-lined boxes, entirely sealed away in the silent, dust-covered archives of our medical history. Yet, the chilling, invisible presence of those anonymous, faceless silhouettes continues to quietly haunt the pristine, brightly illuminated corridors of our modern, thoroughly sanitized world. We are profoundly fortunate to exist in a glittering, unprecedented age of painless miracles, but we must never completely forget the heavy, blood-soaked price that directly purchased our comforting anesthesia. The very next time you find yourself lying vulnerable under the blinding, clinical lights of a hospital room, take a brief moment to listen closely to the quiet, rhythmic hum of the machinery. Hidden just beneath that comforting, digital pulse, you might softly hear the faint, echoing scrape of a rusted blade against bone, serving as a ghostly reminder of the brutal darkness we crawled out from. If you found yourself deeply captivated by this terrifying, unflinching descent into the macabre foundations of human survival, there are still many more chilling shadows waiting to be carefully uncovered. Consider stepping even further into the darkness by exploring our next historical investigation, where we will thoroughly examine the deeply disturbing, labyrinthine horrors of the early Victorian psychiatric asylums. The human mind is a fragile, easily shattered sanctuary, and the brutal mechanical methods used to allegedly cure madness were often far more terrifying than the psychological affliction itself. Allow this channel to serve as your trusted, unwavering lantern as we continuously navigate the darkest, most deliberately forgotten corners of our collective, deeply terrifying human history. Until we meet again in the heavy fog, carefully question every pristine surface you encounter, and always remember that the most dangerous, unforgiving monsters often wear the spotless, white coats of our trusted savior.